Hey guys, I'm Colby Sutton. I'm an occupational therapy assistant student here at Arkansas Tech University.
I'm Khandie Yarber, and I'm also an OTA student at Arkansas Tech University. Today we're going to be talking about the rehabilitative frame of reference, which is the belief that an individual can relearn skills, develop compensatory strategies, and learn to use adaptive techniques. The population that you would work with in this group are going to be individuals born with congenital diseases, individuals that have experienced trauma such as an amputation or a stroke. This is going to be people who do not have an issue and are functional, are going to be able to dress themselves in a timely manner without compensatory strategies and adaptive techniques, versus a person that has some sort of dysfunction is going to have to learn to use compensatory strategies and develop techniques to help themselves get dressed.
Okay. Some of mainly the intervention that the OTA or the OT practitioner is going to address is allowing their clients to be functional in their activities of daily living. So an intervention would probably simulate what we're going to show here today, giving our clients some compensatory strategies to allow them to dress efficiently is what we're going to show today. The setting for this frame of reference can be in multiple settings, such as an in-home, which we're going to show today. You could do this in acute care, and that would simulate an OT letting their client leave with the knowledge that they need to participate in activities of daily living or any occupations for that matter. So a wide range of settings that this can encompass. The goal of the intervention, like I said before and like Ms. Khandie said, is allowing the client to participate in any occupation that they have lost ability in. And this can, like we've touched on the point that this can be from birth, and from that point of view, you're taking it from a habilitating point. You're saying, okay, we're learning these new skills so that you can participate, versus the rehab, which we're going to show today, which is relearning skills after you have lost this. So Ms. Khandie has experienced a brachial plexus injury in her right upper extremity. So from here, we're going to show what a treatment session might look like in the in-home setting. So, hey Ms. Khandie, how are you today?
I'm good. How are you?
Doing good. Okay, so today we're going to work on getting dressed. So I figure since your injury, you've been struggling with getting dressed timely. It's kind of difficult. So today we're going to show you some strategies that you can use to help you get dressed easier, accommodating for your injury that you've had. So our first method that we're going to use is getting a shirt on can be very difficult when you only have one arm, correct? And so what we're going to do is we're going to put this shirt on the back of the chair and start out with it here, and we're going to use our unaffected arm. We're going to reach across our body, thread our arm through our affected limb, just like so. Perfect. And that shows you just a quick technique that can take something as simple as donning a shirt that might take her an hour to do if she was trying to do it in an alternative way. And that took about 10 seconds, so good job on that. So now that we've got our upper body dressed, we're going to have to put clothes on our lower body. So Ms. Khandie has got her pants that she has picked out to wear today. And we're going to use this strategy of remaining in a seated position due to safety, not having that limb to catch yourself if you become unbalanced while putting on pants can be dangerous. So we want to keep her in the seated position, and she's going to thread one leg with her unaffected arm and then put her other one up just like so. She can stand, so she's going to pull her pants up all the way. And something that we're going to elaborate a little bit on is the fact that we are making an adaptation with Ms. Khandie because these are elastic pants. Not all the time your patients will be able to fasten a button or a belt with one hand. So you can make accommodations. A lot of patients don't like elastic, so they might want to wear blue jeans. So you could even come up with creative techniques like putting a rubber band around their button to make fastening their pants easier. So there's a lot of different areas that you can adapt to make their environment more functional and easier to participate in. So now that Ms. Khandie is fully dressed, that is an example of how you can use the rehabilitative frame of reference after a brachial plexus injury. Thanks.
Thank you.